So here to explain how, the committee member and Congresswoman Diane Black. Welcome to the show, Congressman Black. Pleasure to have you on.
Well, thank you, Adam. It's great to be with you.
All right, so how'd it go today inside that meeting?
Well, I think the important thing was to listen to what Dr. Almendorf had to say to us about our future budget outlook, and to recognize that one of the things we do have in common with our counterparts on the other side of the aisle and also bicameral over in the Senate is that we recognize that we've got to get our spending under control, and we've got to get our debt under control, because that definitely affects our future of our country, the security of our country, and most importantly, the future generations, like my grandchildren.
Sure, and you know, the deficit is actually down significantly versus it was where it was a year ago. It's right now about 4% of GDP. It was about 9%. Sequestration 1.0 actually has something to do with that. So is sequestration necessarily a bad thing?
No, I think that sequestration, although I don't like the across-the-board cuts, it is not really the way we should do our household budgets, or in my business, I don't cut across the board. I do things in a more laser-like fashion, but at least what it did is it showed that we could reduce our spending, and that there would still be operations, things that operate here in our country and move forward. This is the first time since the 1950s we've been able to cut our budget for 2 years in a row, and we do need to take a look at the way we do that and do it in, like as I say, maybe a more laser-like fashion, but that's a good thing. And you know what? If we don't do anything, the sequester goes into effect in January. It doesn't close down the government, because we already have a plan for what will happen if the Budget Committee is not successful, but I am still hopeful that we're going to be able to find a way to work together.
Sorry, Adam. What is the plan if you can't reach an agreement by that January deadline?
Well, we still have the sequester in place. It's law, and the law will continue to take effect as it has in the last 2 years with the sequester, and we already had that set forward in our Budget Control Act, and the sequester is there, and it will take effect. So the country will not close down, but we do need to find a way to work together with the Senate. You know, since I've been here 2.5 years, this is the first time that the Senate has passed a budget. We're into what we call regular order. We're in conference committee, and as Mr. Almendorf said today, even a small step toward deficit control and keeping our debt under control is a step toward a positive thing for the future. So I believe even if we can get a small step out of this, it will be a success.
Representative Black, we've only got about a minute left. You're a former ER nurse. I owe people like you a lot, because you've helped me many times over the years. You are not a fan of the Affordable Care Act. Why not?
No, because I believe that this, what we're seeing happen right now is just devastating. And we can talk about numbers, but I'm going to talk about people. I'm going to talk about people who have been calling my office and telling me that they're losing their insurance. For those who are trying to get onto the website, they can't get on there. We've had 28,000 people who lost their insurance in one day when our state had to drop what they were doing because it didn't meet the criteria in the Affordable Care Act. And, you know, these are real people. And so I am not in favor of just turning our entire healthcare system over when we could have taken care of the problems that the Act was supposed to address. And now we're seeing just a devastation of healthcare and the way it's provided in our country.
Representative Diane Black of Tennessee, thanks for joining us today.
You're so welcome. Thank you for having me.